Hi everyone, it's Dr. Gambhir. Hope you're doing well. Wanted to talk to you today a little bit about filler for the hands and in general hand rejuvenation as well. So we often have a huge focus, and rightfully so, on the face as we're going through the aging process, but our age is sometimes given away by other areas. Neck, décolleté, which we'll talk about at different times, but also the hands. Some of the common issues that occur with the hands: number one, the skin can begin to look a little bit crepey or loose. Number two, we start to lose volume in the hands, and therefore our bones and tendons start to show more. And third, our veins start to enlarge a little bit more as well. For this video, we're going to focus more on revolumization of the hands. Revolumization can happen in two ways. One is through the use of fillers. Velour, which is an Allergan product, and also Radiesse are two common fillers which are used in the hands. That filler is placed between the bony parts of the hand to regain that volume. The procedure takes about 4 or 5 minutes per hand and can last easily 6 to 12 months. And as we keep up with that filler, the body can actually make a little bit of collagen around that filler, giving us even longer lasting results. If we desire, we can actually also build collagen in the hands as well. We use a product called Sculptra, which is not a filler, but it's actually a stimulant. So it stimulates the production of collagen in the hands. It's not an instantaneous effect, but it not only volumizes, but that collagen also gives better texture and volume support to the overlying skin, so creating less crinkles basically in the overlying skin. A combined approach, as always, is often the best approach. Side effects are pretty minimal: bruising, swelling, otherwise a pretty straightforward procedure. Thanks for listening.